Teachers are God's gift to mankind. We are where we are by their excellent expertise in inculcating into us the very best. Teachers take us to where we are. So, in that regard, we have wonderful teachers who bring into us the ability to learn the very characteristics that are required to be a good character and personality and everything else. But amongst teachers, there are the very best. And in this field of speech and hearing, we have Madam Rashmi Pai, who is the principal of the Speech and Hearing School of the A.J.Institute of Medical Sciences. And a host of students, on asking them, they chose her name as the very best. They said she is outstanding and excellent. So in that regard, we are privileged to have her in our midst as a fantastic teacher. And many students said she is the very best. So in that regard, News Karnataka, was a major media platform, decided to honor a teacher every month. These are the people to whom our recognition and our gratitude should flow strong. And in that regard, I invite the Executive Director of News Karnataka, Mr. Brijesh, to please hand over a citation and a cover. Thank you so much, Mr. Brijesh. Teachers contribute a whole lot of their effort, time and commitment to building us what we are. Sometimes I am a little touched because many teachers have told me they have 4 or 5 or 6 lectures per day. How much of effort and strain they have to go through. Eventually, especially for the junior classes, they have enormous amount of voice strain and eventually develop what are called vocal nodules, the teacher's nodule. Sometimes it becomes so bad that it even requires surgery. But then before that, teachers must be trained on the proper use of voice so that they do not have the strain that they so much endure. And in that, we have the principal of the Speech and Hearing School of the A.J. Institute of Medical Science, Mrs. Rashmi Pai, who will tell us today morning what teachers need to be careful of, how they can utilize your voice, fundamentals of vocal hygiene, any requirement exercises that they can ensure to maintain proper vocal health, and to make sure that I have operated quite a few number of teachers who later developed a nodule and they can't talk also. When there's a nodule, the vocal cords are not able to approximate, there's a voice leak and sometimes they lose your voice. Voice for a teacher is the most precious gift, and in order to conserve that and have it as a precious gift for lifetime, Mrs. Rashmi Pai this morning, principal of the Speech and Hearing School, will please tell us today morning about vocal hygiene for teachers.
Thank you, sir. So vocal hygiene for teachers. Voice is something that all of us have it and we all take it for granted because we don't realize its importance because it's there at ease. Okay? And only when it is not there for a significant duration of time we realize the importance of it, because we can't imagine doing any activity in our day without our voice. May it be just talking to someone, may it be just expressing what we feel, may it be talking to a student, giving a lecture, anything of that sort. So voice is something which makes our life very meaningful, and so we need to take care of it. So coming to teachers, all of us who are into teaching need to use our voice for our day-to-day living. So we are also called as professional voice users. So unless we take care of our voice, we cannot do things. Our job requires our voice to be perfect. Okay, so there are 4 things we actually need to focus on in terms of our voice. There are basically 3 systems here. That is your respiratory system, that is your lungs, which you need to be very strong with, your voice box, that's your larynx, okay, and your oral and the nasal cavity, your mouth and the nose. So if all these 4 systems are perfect, we don't have to worry about our voice. So that is what we need to take care of. Start with something as simple as breathing, wherein we have this habit of having very shallow breathing. It's like this. When we run very fast, and we would have noticed we go out of breath when we sing or when we talk for longer duration. So similar thing. So over here, if we should have this deep abdominal breathing. Okay, and then once this air which we breathe out, it comes to the voice box level. Okay, that vibrates. There is something called as vocal folds at this level of your larynx, okay, which vibrate. So this cords, the vocal folds, are in closed position when we speak and they are in open position when we breathe. So while we speak, we definitely need to breathe. So it vibrates, close and open, close and open. Okay, so that is what is our voicing, that is a phonation, and the voicing that is produced at this level comes out through your mouth. So how we are going to say it, because voicing will be similar, how we are going to say it is dependent upon our mouth and our nasal cavity. For example, when I say A and E, the voicing that is happening over here is similar, but what is changing is my oral cavity, my mouth. I'm saying A, E. So how it is changing? Oo. Okay, based on that our voice changes. So it is important that we talk in a with a proper placement. Yeah. So now in terms of voice, because we are mainly looking at voice today, we have 4 things that we then to look in. That is your pitch of your voice, your loudness of your voice, the quality of your voice, okay, and the flexibility. The pitch, we need to have right pitch for our age, we need to have right pitch for our gender, that is whether males or females. Females normally have higher pitch, males have a lower pitch. Coming to loudness, there is no point if we have the matter and we are not loud enough. So we have to have adequate loudness. Similarly, we should not be too loud because it can again harm our voice. Next is your quality. It's always nice to listen to someone who is pleasant to hear. The quality has to be good. And coming to flexibility, if we are very monotonous without any, even if a question mark and a statement, if it sounds the same, we don't listen to it. So the flexibility in your voice has to be there. There are 4 things which need to focus on. So for this, now the most of all, which breathing you can control by you having your healthy daily habits, like you exercise, you have simple things as your walks, that will definitely help. Your breathing exercises help a lot to strengthen your breathing. Okay, that is like the power supply to your voice box. Coming to your voice box, now your oral and the nasal cavity, your mouth and the nose, it's not like you can do something with your mouth and the nose, but then yes, you need to have a proper place. While speaking as such, you have to keep your mouth open. I can talk like this, but it might not be very clear when I'm talking like this. Yeah, so open mouth approach is something which is good. Okay, and the nasal part, it is automatically taken care of by the mechanism which is already present. Now what we can do actively is about this part, that is your voice box. So here, simple thing, as I mentioned, there are 2 cords over here which keep vibrating. So the first thing is lubrication, which is required over here. So how do we provide the lubrication? Drink lot of water. Okay, so the minimum of about 3 liters of water is something what we require. Now this 3 liters, I don't mean when you drink something like 1 liter at a stretch and again go ahead. It's not that, but every time you feel there's some kind of dryness or some kind of some itchy feeling in your throat, immediately take a sip of water. Now teachers, you're going to have 3 to 4 hours of classes every day or even more than that. Teachers who are with the younger classes, I mean the nursery and the kindergarten, okay, it is even more worse because kids make a lot of noise. So we have to basically scream or talk at much louder voice about them. So at that moment, again, every 15 minutes try to take a sip of water. That definitely helps a lot. And the water need not be too hot. Some of us have this thing in mind. If you drink hot water or hot tea, it is going to solve. No. Something which is very hot is as harmful as something which is very cold, like your ice creams. So avoid extreme hot or cold things to have. Lukewarm water is perfect to have, but have at least about 3 liters in a day. Coming to your food habits. In your food habits, avoid oily things. Okay, Mangalore ghee roast is something which is very common, but yes, we have to avoid it. Okay, but if you still like it, yeah, after that maybe have a little of something which soothes it, so that you don't have acidity after that, you don't have any kind of itchy sensation in your throat. That part has to be, so avoid spicy, avoid oily things. Okay, avoid any exposure to any kind of irritants. That is something like your the dust, it could be the smoke, it could be some of us use a lot of strong perfumes, so even that has to be avoided. Okay, we use disinfectants during COVID times. A lot of us used to always have this disinfectant bottles in our sprays in our with us everywhere, so that can also cause irritation. So anything that causes irritation has to be avoided. The moment you find there's an irritation or there's dryness in your throat, immediately take a sip of water. Helps a lot. Lifting heavy things. When you're lifting some things, like for example, for teachers, it is like when you carry a lot of books. Okay, when you really lift it up and then it goes like that. Okay, and that is again very stressful for your voice, so that is again to be avoided. Okay, having we have this thing, we get tired and tired when we are talking about the food. When we are entire day you're tired and you don't have time for anything, you just feel like you finish your dinner and just go off to sleep. No, please avoid that. After your dinner or after your meals, basically at least half an hour, do not lie down, because that is going to cause GERD again. It's acidity. You might feel some kind of acidity in your throat, so it's called as a GERD. So that can be avoided. Okay, basically we feel, yes, when we have try to give rest in between your the duration of talking that you have. Suppose you have entire 1 hour of class, do not engage entire 1 hour into just talking, because you need to give rest over here to your vocal cords, and otherwise it's going to cause a lot of fatigue, and the more the fatigue or more the problem, problem is going to be worse. That part has to be taken care of. What you can do is you can give some part, you can make given something, you can use a lot of this audiovisual devices. You have the projectors, when some things can be written on it instead of dictating, students can copy onto it. That part can be taken care of. One more thing, which I had recently had a workshop with the teachers, wherein they mentioned the chalk dust irritates them a lot. Okay, so that part also, wherein there was this method of even the blackboard, when they erase, instead of just going this way horizontal, they can just go downward, so the dust does not come and irritate you further. So such things, precautions can be taken. If the class is really very big, use small mic, public addressing systems it's called, but small ones also are available, because you need to scream, and your screaming is not just for that 1 hour, and it can go on for much longer as well. So that part also can be taken care of. A small mics are available, like the one which you're wearing, something like that, which can be used, and the teacher, the students, the message can be conveyed, and you don't strain your voice as well. So mainly your breathing to be taken care of, your lubrication or hydration, which is to be taken care of, voice rest in between when you're talking, that has to be taken care of. And then we also have this thing, when we have been told not to speak, we try to whisper, we say, what is this? Okay, that is much more harmful for your voice as compared to your regular talking. Okay, so that is to be avoided. We are very good at mimicking. Mimicry is bad for our throat, because we are trying to use our voice for somebody, trying to use it not in a natural way, but to like somebody else, which is again harmful for us. So mimicry, all that has screaming, all that has to be avoided. So if we take care of those things, definitely it makes a lot of difference. And sometimes, yes, we are not able to avoid situations wherein we need to talk. Yes, I have to give in a lecture for 3 hours, I have to give it. So there are some warm-up exercises which can be done, simple breathing exercises, simple humming, okay, which can be done. So you can always, if you feel any problem, you can always take professional advice, because it won't be right on my part to give you exercises right over here, because it has to be supervised first. So that is one thing. And in case if you find any change in your voice, do not wait for it to worsen further, because the further you wait, the worse it's going to get. So immediately take professional advice, because your voice matters a lot, and you as a teacher make a lot of difference in everyone's life, not just your own life, but everyone's life. Your voice definitely matters. Thank you.
Madam Rashmi, I must confess that there's a vast coverage of the voice and difficulties that teachers face that you have made this morning. That shows why our college, the Speech and Hearing School of the A.J.Institute, is so good. Primarily by the direction of the management and their support, especially our Vice President, Mr. Prashant Shetty, we have developed the finest speech and hearing school. So in that regard, when a teacher has a problem and they come to us, can you a little bit highlight on the facilities that we have, the voice lab and other things, so that they also have an idea that there is a center of excellence which can totally revert them back, unless of course I am a surgeon, I would like to operate, but then they from their side would like to avoid surgery as much as possible. So will you please highlight a little bit how, when they are on the brink of surgery, how we can revert them back and segue them back to normal, fantastic social life?
Yes, sir. So teachers, when they come to us, yes, they have a change in their voice. When they come in the beginning, in the very initial stages, sometimes it's the growth in the vocal folds, it's called as a nodule. When they come in initially, the size can be very small, okay, and this, if the size is very small, we need not go in for surgery immediately, because this can resolve with voice rest that can be given to you. But if you wait for too long, nodule size increases, then you have to go for surgery. So that part is something which you need to look on. So even if there is a slight change, yes, you have to consult, okay. Second thing is, yes, in spite of having nodules, in spite of being counseled about surgery, there are people who try to wait and like, okay, no, somebody else also had a similar problem and then they got over it and things like that. So that is to be avoided. So when you come here, what we do is we assess your voice. So a simple thing is, we try to take an entire case history about what exactly is a thing, how much of voice are you using, how many hours are you using. After that, we have analysis, which is one is, yes, as per what we hear, that's a perceptual analysis, and we also have acoustic analysis, which is a software based system, okay, so which will analyze what is your pitch, what is your loudness, where is the change in your, I have mentioned about flexibility of voice, so where is the change in your voice. So all those features can be analyzed, and then based on all of this, we try to help you out. We give you therapy techniques, okay, and which you need to follow and bring back your voice back on track basically. So that is what is done in the department. Also post surgery, when for example the nodule is removed, okay, yes, many of us feel that yes, it's a small surgery and they might, it's a minor surgery, so we can just get back to normal. We've had patients who the next day of the surgery they are back home, so then what they do is they try to lift heavy things and things like that. So post surgical care also is very important. So even that is taken care of for you, and you need to take rest after the surgery, the voice rest. So all that part has been taken care of when you consult and when you come for professional help.
What they are really terrified of when I tell them that you need to undergo surgery is, if I bite a millimeter more into the cords, will they lose their voice and more catastrophe can happen. So that's when we really say that we have a fantastic department whose treatment, if you undergo properly, you can revert completely back. And therefore, on that regard, I am asking you, should a teacher at least once a year come and, like we ask for a checkup for a human body, or for him come and check up and seek your guidance? Are they using their voice properly, so that in future problems will not happen? And have you found that these problems are more in the lower schools, because they need to really scream at younger children, whereas the higher guys are more mature and they do not take as much stress?
Yes, sir. It will be really nice if the teachers, it's about how we do our regular health checkups. So a voice checkup also, if it's included in that, it will be wonderful.
Absolutely.
And things like, yes, like you said, so the younger classes, they scream. I mean, they need to talk much louder, top of their voice. Because at home we would have noticed, we have 1 or 2 kids, we actually raise our voice so much. So having 30-40 kids in a class is definitely very difficult. There was a research study which was done, which showed that yes, we are all singers, the actors, all of those are professional voice users, but teachers are literally 5 times at a higher risk of getting voice problems as compared to others. So teachers are the first individuals who have to come and take help in this regard.
And you have found they who have nodules and then we advise surgery, but over time with your expertise and care, they have completely reverted back to normalcy.
Yes,
so
sir. Yes, sir.
They need not get frightened, oh my God, I have to undergo surgery and expense and risk and other things. We have a department who under their care, we have seen people completely revert back. So therefore take advantage of the facility that we have. I've seen your voice lab and the machines, and they evaluate every single consonant and vowel and words, and they revert you back. So teachers in Mangalore are blessed to have a center like this, and a leader heading the college, Ms. Rashmi. It's been a wonderful morning. Thank you so much.
Thank you so much.
Grateful to you.
Thank you.